Tedros, Maria, and Dr. Ryan. I would like, first of all, to say that after 100 days, as you mentioned last time, of COVID-19, as you know, the Association of Accredited Correspondents at UN Geneva is covering with you this outbreak, and we are expressing our empathy for the hard work you are doing to keep us worldwide, media and us informed, and we look forward to have closest cooperation with you, and that we, ACANU, will have the opportunity to have briefings exclusively for our members. Thank you, Dr. Tedros. This said, I would like to ask you a technical question about the testing. I would like to have your opinion about the different tests. What is the difference and the efficiency between an antibody test like serologic test, the chest CT scan, the RT-PCR? What do you think, which of these tests are the most trustable at this level of knowledge? And also your opinion about antibodies treatments that some countries are testing. Thank you so much.
I can start, and Maria will give you more detail. I think we've issued guidance, a technical document very recently on the different tests and different availability and different uses of tests out there. In fact, this afternoon we had a very interesting and deep discussion with our strategic and technical advisory group on infectious hazards, just to look at this, because it's a confusing world out there now with rapid tests and antibody tests and antigen tests and PCR tests, and countries are grappling with what is the best choice for them. It would be best to look at that document, but to make it to be very straightforward, and in this forum, the PCR-based test, the test which you see every day of the swab being pushed up somebody's nose, the testing for that is usually based on identifying the coronavirus directly, by finding its RNA, by finding the actual evidence that the bug is in your nose. Those tests have been distributed widely around the world and are probably the most accurate way to determine whether someone is currently infected. In other words, the virus is in their body. X-rays can confirm that someone has pneumonia. An X-ray does not confirm that you have coronavirus. But if you have a positive coronavirus test and your X-ray or chest X-ray or your CT scan shows that you have pneumonia, then obviously the physician can attribute the pneumonia to the coronavirus. A chest X-ray alone, it's very difficult. Atypical pneumonia or viral pneumonia can be very non-specific, although colleagues around the world, clinicians, are becoming very skilled at interpreting those results, and Maria may speak to that. With regard to antibody tests do not test or detect the virus. What they do is they detect your immune response to the virus. And it takes days and weeks to develop that full immune response, so it can be detected by those blood tests. And in this case, antibody tests require the taking of a blood sample or a pinprick on the finger, a small blood sample, and you try to detect the antibodies. In general, the PCR-based tests are better for telling whether you're infected or not, and the serology test or the blood test is better to detect whether you've been infected recently or in the past. And there are different types of antibody you test for, IgM and IgG, that can tell you more. So it's a complex issue. Right now, for governments, they need to focus specifically on PCR-based testing or any form of testing that detects active infection. But serology and serologic tests are extremely important for determining how many people have been infected in the population, and those data are very important to tell us where we're going in this epidemic. Maria?
Yeah, so only to add is that it is confusing because there's hundreds of tests available. So on the one hand, because the virus was identified so quickly and sequences were shared so quickly, a number of labs across the globe were able to develop PCR kits. And so there are a number of PCR or molecular tests, and these are the tests that will, as Mike said, detect if you are currently infected with coronavirus. So there's hundreds of those that are on the market. And we are working with our collaborating center labs and with FIND to do an evaluation of the tests that are on the market so that we can see how well they perform when actually being tested on clinical samples. So that is a process that's ongoing. And that is typical when you have an emerging pathogen. This is a process that needs to take place when you have new tests on the market. We're going to be doing the same thing with the serologic assays that are also on the market. We did issue a scientific brief a few days ago, which outlines why it's difficult right now to be able to use rapid antibody tests, which do not detect acute or current infection, but do detect if you were infected in the past. And we recommend those right now for research. And so those are absolutely critical to be able to evaluate what proportion of the population has been infected with this novel coronavirus. But there is a lot on the market, and this is a positive thing. What we need to do is we need to make sure that they are evaluated and validated across multiple labs so that we can see how well they do perform in actual use by countries.
Thank you very much for these detailed answers, and thank you, Catherine, for your kind words on behalf of ACANO Association, Geneva-based correspondents, and for your proposal that we